Hello everyone, welcome to the 72 Dragons Health Channel. I am Dr. Pietro Aparicio. We are reporting on the World Health Assembly 2024's latest advancements in global health. Today, we will discuss health equity in the World Health Assembly 2024. The 77th session of the World Health Assembly, the decision-making body of the World Health Organization, took place from May 27 to June 1st, 2024. During this session, delegates reviewed and discussed the Executive Board's policy agenda for the upcoming year, establishing health goals and strategies to steer the World Health Organization's public health initiatives. The theme for this year's event was Health for All for Health, reflecting a commitment to global health equity and universal access to healthcare. The Assembly was a platform for health experts to debate and formulate global policies addressing critical healthcare issues. Participants collaborated on developing strategies to enhance health systems worldwide, ensuring comprehensive healthcare services are accessible to all populations. The decisions made at this session will guide the World Health Organization's efforts to promote public health globally in the coming year. According to the World Health Organization, equity is the absence of unfair, avoidable, or remediable differences among groups defined by social, economic, demographic, or other factors like sex, gender, ethnicity, disability, or sexual orientation. Achieving health equity means everyone can reach their full health potential, which is influenced by the conditions in which they are born, grow, live, work, play, and age, alongside biological factors. As per the Centers for Disease Control and Prevention (CDC), health equity means ensuring everyone has a fair and just opportunity to achieve their highest level of health. Achieving this demands continuous societal efforts to address historical and current injustices, overcome economic and social barriers to health and healthcare, and eliminate preventable health disparities. To realize health equity, it is essential to reform the systems and policies that have perpetuated generational injustices, leading to racial and ethnic health disparities. The World Health Assembly plays a crucial role in advancing health equity by setting global health agendas and policies to ensure fair and just access to healthcare for all. Through discussions and conferences, the World Health Assembly addresses injustices, tackles economic and social barriers, and strives to eliminate health disparities. By promoting comprehensive strategies and reforms, the World Health Assembly supports the global pursuit of health equity, ensuring everyone can attain their highest potential for health and well-being. The 77th session of the World Health Assembly has concluded, and we now await the implementation of its decisions and updates on their impact. Let us look forward to the next assembly for continued progress in global health initiatives. That's all for today. If you like this video, please give it a thumbs up and subscribe for more valuable information. Thanks for watching.